Congratulations, you're pregnant! This series of videos will give you the basics on what to expect throughout pregnancy, birth, and afterwards. You will see many different members of our team who you might meet during your pregnancy, and please feel free to reach out with any further questions or to join some of our amazing in-person and comprehensive antenatal class options. Our King's midwives will support you throughout your whole journey alongside your consultant obstetrician with education, preparation, labour care and post-birth care in the hospital and at home.
Now you're seeing these videos, you should be around 20 weeks pregnant. We're going to talk through what to expect for the rest of the pregnancy and the things that you can do to help you prepare. Please remember, every pregnancy is unique and your obstetrician will recommend the care plan that is recommended for you. This will be a general guide. Your next appointment will usually be around 24 to 28 weeks, where you will usually have a scan, a normal antenatal checkup, and also be offered a glucose tolerance test. And this is to check for your gestational diabetes in pregnancy. After this, between 32 and 38 weeks, you will usually be seen every 2 weeks for a general pregnancy checkup. It is then usual to have a weekly checkup with your obstetrician until the baby is born.
You will have fetal medicine scans during your pregnancy a few times. The first one will be between 11 and 14 weeks. This is the time when we confirm the due date, when we do screening for chromosomal abnormalities, mainly Down syndrome. That's we do it by have measurements on your baby, a fluid behind the neck, we look at the nasal bone, and we do some blood testing. There is also another test called an IPT that sometimes is offered and has a very high detection rate that we can also offer at this stage. Also, we do an early check of the anatomy of the baby, and we do a screening by measuring the blood flow from you to the baby to assess for the risk of developing preeclampsia or high blood pressure or having a small size baby. And after confirming that you are a low risk pregnancy, we will see you again at around 20 weeks to do the anatomy scan, where a baby will be fully developed at that time. We'll check all the structures in the baby from the head down to the toe to make sure that everything is forming normally. And also we make sure that your cervix is long and closed, and we assess the risk of early delivery by this measurement. At around 32 to 36 weeks, that will be your last routine visit, where we will check how the babies are growing. We will check the blood flow in the baby and in the baby's brain, and also we check the well-being of the baby. And we wish you all a joyful pregnancy and a safe delivery.
It is advisable to book your antenatal class with a midwife team around 30 weeks or later. Following this, we recommend making your birth plan around 34 weeks, and we are available to support you with this process. At 37 weeks, you can schedule an appointment with our lactation consultant who can assist you with breastfeeding preparation, including colostrum collection.
After your baby is born, you'll stay on the 6th floor postnatal ward, usually for 1 or 2 nights after a vaginal birth and 3 or 4 nights after a C-section. There's open visiting on the 6th floor. Baby will be in the room with you, but our team will be on hand to support and care for you and your baby in the first few days before you're discharged home. After this, you can sign up for our home midwife package, where we'll visit you at home for approximately an hour per visit and do a clinical check on you and baby, including weighing, jaundice checking and feeding support, and answer any questions that you might have.